I'm delighted to introduce you to Stanford Hospital and to our residency program in internal medicine. I'm Nick Feeback, the chair of medicine at Stanford Hospital. I've spent most of my career in academic medicine, most recently 15 years on the faculty at Columbia, where I started as the residency program director for 5 years. So I'm very aware of and invested in training for our residents. I came to Stanford as the chair of medicine 2 years ago, and I found this to be really a tremendous place to train in internal medicine. As you apply for residency positions, you'll become a connoisseur of residency programs in internal medicine. I think you'll find that there are many similarities between programs and some differences. And the challenge for you will not necessarily be to find the best program, but to find the best program for you, to find the best match, not in the NRMP supercomputer sense, but in the old-fashioned sense, to find a program where you can see yourself fitting in and where you can see yourself achieving the goals for the kind of training and the launch for a future career in medicine that you're looking for. So I'll give you my perspective on the essential ingredients of our residency program. I think for all residency programs there are 3 key ingredients. The first is patience. Here at Stanford we see quite a diverse array of patients. We're located in Fairfield County, a fairly prosperous suburban county that's part of the New York metro area. But the city of Stanford itself is quite diverse, with a large working class population and a large immigrant population. And so the patients at Stanford Hospital on our medicine floors and in our ICU really represent a great socioeconomic and ethnic and racial diversity. We see lots of different people as our patients, and they're all together in the same hospital. Our hospital, in addition to serving this fairly well-to-do suburban community, is a designated safety net hospital, and our residence continuity clinic is at a federally qualified health center in Stanford, which is part of the backbone of serving patients who otherwise couldn't get care. We also see a wonderful medical diversity of patients. Because we serve as the hospital for Stanford and the surrounding community, we see lots of patients presenting with the first manifestations of their illness. We see a lot of so-called bread and butter diagnoses in medicine. But because we're a regional referral center and a place for expertise in many disciplines and subspecialties, we also see lots of interesting, rare, complicated, refractory patients. And because of that expertise, because we're familiar taking care of those patients, we don't miss those unusual cases when they come. We take care of most of the patients who come here without needing to refer them. Which leads me to the second important ingredient in residency training, and that's our faculty, the attendings that you learn from. We have experts really across the spectrum of internal medicine. For example, our cardiologists include invasive cardiologists, electrophysiologists, who perform all of the state-of-the-art, state-of-the-science procedures that are done at academic medical centers. We'll be approaching our 200th TAVR in our cardiac lab this year. Our oncologists are part of the Dana-Farber Brigham and Women's Cancer Collaborative and offer the latest innovations in oncologic therapy. Across the hospital, we do everything here except transplant. So we have cardiac surgeons who do open heart surgery. Our interventional radiologists do everything that any interventional radiologist does anywhere. We have an acute stroke thrombectomy program. So the point is to say that we see and can take care of and utilize the most sophisticated techniques in medicine, in addition to working on patients with common diagnoses. Over 100 of our faculty, of our attendings, hold faculty appointments at the Vagelos College of Physicians and Surgeons at Columbia University. The third really important ingredient in residency training is peers. It's fellow residents. After all, during residency, you're going to spend more time with your fellow residents than you will with significant others in your life. And your fellow residents will also be very important teachers, especially when you're interns, but even as you transition through second and third year, there's a tremendous amount of peer-to-peer learning that takes place. I think we recruit a tremendous group of residents, a diverse group of residents from many different backgrounds who are committed to supporting and teaching their fellow residents. But I'm going to leave it to you to form your own impressions of our residents. And even though we're meeting you this year virtually, we'll create lots of opportunities for you to interact with our residents and get a feel for that group. So those are the key ingredients, and there are a couple other special sauces, if you will, that sort of put it all together for an excellent training program. The first is the learning environment. I've mentioned that our attendings are faculty at Columbia University. We're a major educational affiliate of Columbia. Columbia students do clerkships here. On medicine, we have medical students also from Quinnipiac University Medical School, the Frank Netter School of Medicine at Quinnipiac University, doing medicine clerkships, and we have Columbia and other students doing sub-internships in our wards and in our units. So the learning environment here is, in fact, very scholarly, very evidence-based. You may have found in your rotations in internal medicine that we internists like to talk a lot. Perhaps that's one of the reasons you're attracted to internal medicine. Our rounds are filled with discussions on the patient stories, on the scientific evidence, on the pathophysiology. And we encourage that rich learning environment on our general medical floors, in our intensive care unit, and at the residence continuity clinic. We're also a Plane Tree hospital. You may not know what a Plane Tree hospital is. Plane Tree is an organization that was founded decades ago to promote patient and family-centered care for hospitalized patients. And it includes providing a healing environment, attention to quiet, to light-filled spaces, to spaces for family to be with their loved ones, attention to nutrition. And it extends, I think, to a culture of collaboration, not just with patients as people and their families, but to interprofessional collaboration, to working with nurses and other staff here. And that's really a wonderful, supportive learning environment when you're a resident. The second special sauce is mentoring. That is providing guidance and advising to help each individual resident take advantage of all of these ingredients in the learning environment. We're a relatively small program. We're in the midst of expanding from 7 to 8 residents in each PGY year. And we take advantage of that small size. The small size in itself is not enough to ensure that we provide individualized attention. But Dr. Homa Yunruz and her team have set up a system of advising, of evaluation and feedback, and of mentoring that really does provide a lot of individual guidance and individualized training curricula to our house staff. We have a superb Office of Research here, and we're able to help our residents network to get engaged in research projects, in patient safety and quality improvement projects, and in medical education projects. If you were here in person as a group of intern applicants, I would tell you that even though you're wearing your suits, you should at least figuratively roll up your sleeves, get comfortable here, really get to know us, so you can determine whether this would be a good match for you, a good place to achieve your goals. And even though we're all challenged by doing this remotely now and won't have the opportunity to see you in person, I still encourage you to relax. We understand that for you as well as us, this is a new and perhaps awkward experience. We would not be interviewing you even virtually if we didn't think, based on what we know of you already, that you have the qualifications to be a successful resident here. So relax, get to know us as best you can. Let us know if there's any further information we can provide to you, and we hope someday perhaps that we can meet you personally.